Hi YouTube, I am Derek Grant. If you don't know my story by now, um, I will give you a brief catch up on things. As you can see, I look totally different, and this is some time has passed. So, for the people that have been watching, thank you. I love you so much. Thank you. It has been a long journey. I went through so much. So I don't want to get too far into my story. First, I want to catch up the viewers that have not been watching. So if you're just now seeing this video, this is a way down the line update. So I do apologize for such a late update. But I appreciate you guys for being around and being my follower. So in a couple years back, I had developed very bad keloids on my face, from here to the other side and even under my chin area, that became an abscess that leaked very bad, pus. It was in my beard. There was things trapped inside of there. I was going through a very extreme process that took a lot of patience, and it took a lot of just going through a lot of pain as well, and just it was very depressing. I will admit to you guys, it was very depressing because it was, hideous to the sight of people and not wanting to go around people. So it had brought me to a point where I needed to see a doctor to remove them because they were starting to cause harm to me, and it was prohibiting me from work. So I've got the surgery, went through radiation treatment to try to prevent the keloids from coming back. Because if you know anything about keloids, they tend to have a resurfacing. They tend to come back. And if you are a person that's like kind of played with keloids, you can cut your body and it can just come right back. There's a little small cut and it can turn into a small keloid that can get to bigger, and it grows, which can become infected in some circumstances, in some instances. Mine was one of those extreme instances where it became infected and there was pus leaking out, and I had to constantly drain it. I had to constantly release the pressure that was in there. So a lot of my videos, you see me, I got my gloves. I look horrible. And I probably don't look nothing like where I look now, by great doctors and technology in America today. So this is my update video. So I love you guys. Thank you for your support. I will show you. So as you can see, if you can see a little bit, there we go. That's a good angle. You can see the cut there. Which now I get steroid injections to try to keep down, of course, to keep it from not coming back. So that's pretty much all you can see right now. Is just like a little line of where it was. It covered my whole face, and it was insane. It was insane. It was like really insane. So and I had the expanders here. There was one right here, and I had another one on this side of my chest, which they used this skin to flap over to my face. And I was like, one of my videos, I'm like this. I'm stuck because I'm stuck to the flap, and I had to hold. So it was a very long process. Thank you guys for being amazing viewers, and I will continue because it's not over. It's not over. Like I said, I went through a lot. It was very depressing. I was off work. I was disabled. I had got to the point where I stopped making videos. So I know this is like a long time from my last video. So I hope and pray that everybody watches this video, and anybody that you know that may be going through keloid abscess or anything that's of that nature, please leave your comments somewhere, and I will respond definitely as soon as possible to you to give you information where you can seek a doctor. Your best doctor that you want to go talk to is probably a plastic reconstructive surgeon, not a dermatologist. A dermatologist will not be able to do the surgery needed to remove the keloid. You want to talk to a plastic reconstructive surgeon, because that is who removed my keloids. If you look at me now and you've seen my videos and you've been a follower of my channel, then you will know I look totally different. I love it. I get compliments everywhere I go. You can look my doctor if you are in the Chicago area, because I live in the Chicago area. You can my doctor is in I'm drawing a blank, I'm sorry guys. My doctor is in Chicago. He is at Northwestern University. He is Dr. Galliano, Dr. Robert Galliano. You can look him up on Instagram. He actually has my story on his Instagram, Dr. Robert Galliano, Northwestern University Hospital in Chicago, Illinois. He is the person who did my surgery. And if you want to fly out, if you're from, you're watching my video, and I'm pretty sure you may not be from the Chicago area, you're probably from everywhere. This is YouTube, so this is, everywhere. But make sure I ask that you please share this with anybody that you may know. Share it with anybody that may be going through anything, that may be going through something traumatic, and it may not just be keloid, but to know that there is hope, to not give up, because it was so hard. In one of my videos, one of my followers, I do believe her name is Sarah Stone. I'm sorry if I'm putting your name out there, and but thank you for your amazing words. Thank you a lot of to my followers that commented on my videos for your amazing words of encouragement. I wish I did have a person with me to help me throughout my time that I went through what I went through, but I was alone. And I didn't feel that I wanted to bring somebody into what I was going through. So I suffered alone. So it's very important that you do not suffer alone. Just know that you can leave a comment here. You can send me a message, and I will definitely respond as soon as possible to you, to help you keep encouraged, to encourage you, to enlighten you, to lift you, to definitely keep you going to pursue, and we'll get this thing done together. We'll look into a lot of different resources that you can reach out to, because I do have a couple of resources that could help you and point you maybe in the right direction of especially if it's for what they classify as hypertrophic scar tissue. It's keloid. Again, you want to mainly seek out in your area a plastic reconstructive surgeon. The process I got done was tissue. He grew tissue first. He grew the tissue. If you watch my video, he grew the tissue first. Once he was able to get the tissue, then he cut and removed. Then flapped the tissue to the new tissue to my face. Once he instantly got that there, he radiated it. He did radiation, because he believes that the cure to, or stopping it from progressing further, is radiation. That the radiation will kill the keloid from coming back. So I don't want to make this video too long, but please leave comments, questions, whatever, and I definitely will get back to you as soon as I possibly can. Thank you. God bless you. I love you.